because I have read this document back to front, and I know that it says that all the services will be moved out of the Finsbury Health Centre, all of them. There are 7 services in the Finsbury Health Centre. They're additional to the GP services. And the majority of them, when they mention the St. Luke's, which has not been built, and depends on when building flats, if they don't get the flats, then they don't get the extensions of it to get to St. Luke's. They also mentioned the Amble Street, which I understood was fully booked and not able to take any additional. There are 22,000 users for additional services at Finsbury, plus 14,000 patients with 2 GPs. Now, they are not going to all go into St. Luke's. They're not all going to go into the Amble Street, which is a very limited service. And there is nothing in the south of the borough that can cope with that. There was the old street practice, which actually they enlarged under the Wife and Jill scheme, and that is so fully booked that you cannot get an appointment for podiatry. Podiatry generally has gone from 10 weeks to 14 weeks. To me, that is a cut. Whatever is being said, it is a cut. The fact that you are cutting back, and that is while they're here and being used at the Finsbury Health Centre. When they have to join someone else's queue, then it gets longer. So as far as I'm concerned, two chairs wherever is not the answer to 22,000 users. And I think it's about
my name is Andrew. I lived locally, happily living here for 30 odd years. If the service, everyone seemed very content with the service here, because you have all the medical, different 7 other medical services, 2 doctors' practices. When you attend for one of the other medical services, you can actually talk to people and know the people doing the other services. It's all on one roof. The idea is inclusion. And I think splitting it up will actually dilute the service across the board for the various medical facilities.
Okay, thank you. Anyone else? Yeah.
What annoys me is that you said there's not enough health facilities in North London. And in fact, they sold the Royal Northern Hospital, which was built by public subscription. Then they sold Finsbury Town Hall, also built by public subscription, and told us lies about it. And these things have been done so surreptitiously, really, in a way. They didn't give us enough chance to fight it. And it was like a done deal with Finsbury Town Hall, and this sort of smacks the same kind of thing. It's presented to us like it's going to happen anyway, no matter what it's in. And there's something very wrong with that. My parents lived here, they paid their tax, they got that Finsbury Health Centre built, paid their taxes, and so their parents, and all these things that were built, they're just going to be, washed away, swept away, just for your convenience, your plans and your post.
Okay. Sorry, sir.
I met a different business up in Stratford, and Finsbury Health Centre was a building that I used and relate to my childhood, but that's not really the issue. The question I want to ask, and it's not actually been made clear, is what is actually the nature of what's going to happen to the building, Finsbury Health Centre, once it is sold? Who is actually, what precisely is going to happen to it?
Right, okay. Any other points? Okay, sorry, yeah.
It's been avoided, and I know you've tried to raise it, Michael, well, and I'm going to have to ask this as representation, is are there staffing implications involved in this as well? Because it obviously will, it's caused big resentment within the patients who use the centre, but are there any implications in terms of reductions in jobs?
Okay, now I'd like to, would you like to say something?
There was just one thing that you said in your presentation about these costs that are partners. Now, the Finsbury Health Centre was ours. It is. So who are these partners? is the fact that the cost that you've worked out for £1 million a year to run it, is that because the partners are going to be owning it, basically, and you're renting it? You mentioned renting. Why are you renting it? It's ours.
Yeah, Paul Brandon from Islington Trades Council, also chair, rep for Holloway Bus Garage Club. I mean, I think the battle to save this starts now, and I think there's enough intelligence, humour and energy in this room to save this centre. Now, the policy of Islington Trades Council is to oppose this. I mean, that's as it stands now. So you certainly have our support. What I'm concerned about is what underlies this, underpins this, is actually just about funds. Correct me if I'm wrong, but you mentioned £400,000, I think what it comes down to. That you're actually allocating, it's the allocation of the funds that is actually determining whether or not this centre remains or not. Now that seems to me a scandal in itself. And it actually seems barbaric, bearing in mind just how much you've heard tonight, how loved this building is, how practical it is for the community. And it comes down to a few £100,000 and the allocation of funds in different parts of the borough. Then that is scandalous, and it needs to be fought. There needs to be a campaign to make sure that the funds are found in order to keep this centre alive. Now, I'm chairing a meeting next week at City University in which there's going to be leading trade unions. Come along, it's a public services, not private property meeting. I urge you to come along to this because your campaign is starting and you're going to need to fight to save this centre. It starts now. Come along to the meeting next week. We'll be handing out flyers at the end of this meeting. I hope to see you there. You have my full support. Let's get going and let's make sure this centre's safe.